is Braelynn Neely, and I'm going to do my video on checking the victim and recovery position. So for checking the unconscious victim, you're going to check the scene for safety and ask if the scene is safe. So you're going to tap on the shoulders of the patient and ask if they are okay, and if you realize that they are unresponsive, you're going to call 911 and get the AED immediately. Then you're going to assess the breathing. After calling for help, you're going to check the breathing for at least 5 seconds, but no more than 10 seconds, or until you determine that the person is breathing. You're going to look and listen and feel by putting the head near the victim's face and checking the chest to see if you see any breathing movements. Then you're going to state if the person is breathing or is not breathing. You're going to check the body for signs of any injuries or illnesses. So you're going to check for breathing, if they have any open wounds, or if they have any unconscious feeling toward their body. Then you're going to check for any medical jewelry. For instance, you may see diabetics, which will lead to unconsciousness, or any type of jewelry that you may see that is medical jewelry. Then for the checking an unconscious victim, you, for instance, my Barbie doll here had fallen off of a building while doing some work. You're going to ask, you're going to state that you are trained in first aid and ask if you can help the victim. Now, some patients may say no, but if that is the case, then you want to call for help immediately so that they are being assessed for their injuries. You're going to verbalize and say that you do have gloves on so that you can help them. Now you're going to ask the questions as what had happened or what is wrong. Has this happened before? Any allergies, recent health problems, medications, and time for the last eating and drinking, like how long it has been since they have eaten and drank. Then you're going to talk about the pain, where does it hurt, how long has it hurt, and describe the pain and the rate of the pain. Then you're going to do the head-to-toe assessment. You're going to ask if the victim has fallen and how high the height was, and you're going to tell the victim to try to stay as plain as possible so that you don't have any other injuries while laying there. And then you're going to explain DOTS, so the deformities, open wounds, tenderness, and swelling, to check to see if the patient has any of those. Then you're going to identify for the recovery position if the victim is unconscious but breathing normally. You are going to roll them over to the left side. You're going to put the left arm up by the head, and you are going to bend the knees. So while they are in the recovery position, you're going to do all of the exercises while they are in this position.